Good afternoon. Thank you again for joining us. We got a full program today. In addition to Dr. Box and Dr. Weaver, we have Dr. Dan Rosiniak, and we have Fred Payne also with the Department of Workforce Development. But we'll dive right into this. But first, let me just say last week we mentioned that we were going to extend the executive order for a week, and we were going to track exactly the numbers as they were coming in. We took a very optimistically cautious approach to the trends that we were seeing, and we're still seeing. You'll see in just a moment during Dr. Box's and Dr. Weaver's presentation that our average 7-day positivity rate and over the last 10 days, 2 weeks, we continue to trend down, and also our hospitalization rates and our death rates are moving in the right direction. And we don't like to always say get giddy about this. It's good news. There's a lot of thanks, a lot of credit to people who are taking this seriously and practicing good public health measures. We obviously, as I get out and about, I'm seeing a lot of folks knowing that we're not out of the woods yet, for sure, but we are on a path that looks that we can kind of see our way out, and that's mindful of that we can control only those things that we can control, which is pretty much our personal habits and behavior and routines and best practices. So thank you to every single person that has endured and sacrificed and lost so much. Every single business. We got some good news yesterday, that Indiana's unemployment rate had, and you'll hear more from Fred Payne in just a few moments, but had ticked down to 4.3%, which means, again, credit where credit's due. Our businesses, large and small, are figuring out ways to conduct business safely, and consumers, customers, are taking them up on it. And this is good news. We're the lowest unemployment rate in our region, in the Midwest, lower than any state that we touch and beyond, Wisconsin included and Minnesota. So again, we're on the right path. But we never want to get ahead of ourselves. We never want to overreach. We always want to over-deliver, but never get ahead of ourselves. And so we'll move forward with our continued county-by-county, data-driven approach as the numbers guide us, and we'll be moving to, over the course of the next month, as we extend this executive order, we'll be moving to our county by county a 25%, not 25 people, but a 25% capacity limit for counties that are in red or orange, and a 50% for counties that are in yellow, and 100% for counties that are in blue. And spoiler alert, there are no blue counties as far as
Not yet.
Not yet, exactly. But we are trending in the right direction. Also, I should say that, and you school me on this all the time, that there's always something new coming our way, and it could be these 3 different variants from South Africa, Brazil, and the UK that are projected, and I guess it's anybody's guess. Yours is better than mine, but maybe March. So there's always something out there lurking, but we know what works in any environment, in any situation, and that's got to do with continuing to physically distance and not cram into areas, and wearing face coverings, all those things, all those precautions that we've included in our orders to date. So I just wanted to say thank you. I will sign that new order on Sunday, and again, as I just mentioned, it will go for another 30 days. If you think about this, on January 11th, our positivity rate was 16.5, and today it came in at 9.1.
Pretty impressive.
Pretty impressive. And again, this thing ebbs and flows. We've seen that over the course of 10 plus months, but we want to be prepared to continue to safely, and as I said, maybe in the first week of this, safely and swiftly move away from the pandemic. That's got to do with testing, that's got to do with tracing, that's got to do with vaccinations, that's got to do with therapeutics. A lot goes into determining where we are at any one given moment. In terms of our vaccinations, again, which you'll dive deeper into, we've been in contact, you've been in contact, I've been on calls with all the governors around the country, been on calls with President Biden's White House COVID task force. By all accounts, and there's 75, it seems like there's more than a couple handfuls of people who are grading what's happening out there, but it seems to be the legitimate sources and repositories of the folks that are out there collecting all this information. Indiana tends to rank in the top 3 in the nation in terms of getting our allocation, getting our shots in arms. And again, that's a credit to people stepping up. And I think you'll see later something we're just very excited about are some of those early projections that we talked about, others saying, well, it might be 20% or 30%, or then what does the saturation rate mean in terms of different age groups? Well, we're seeing Hoosiers step up and say, as you said, Eric, they want their lives back. And that seems to be, that's continuing to happen. And so we'll continue to look at the inventory that we have, or that supply that we have. We got some pretty good news yesterday, I guess. Today's Wednesday, right? They all blur together. But we got some pretty good news yesterday from our federal partners, and they, in their kind of 3-week forecast, said that we'll be receiving an additional 16%, I think you mentioned, which equates to about almost, Dr. Weaver can go into this as well, but almost 13,000 extra doses a week. And that will not go to waste.
We can use them.
Yes, that's exactly right. I saw Governor Polis in Colorado holding a similar press conference, and he said, we need more. And did I mention we need more? And what we could really use is more. And all I'm asking for is more. And that's what every governor of every state and territory is making a case for. We have the infrastructure in place. The logistics are built to get this out. Our numbers are showing that. We appreciate FEMA offered some state assistance to stand up more sites. We have over 200 sites in place, and we can scale that up. The locations aren't our limiting factor. It's just the inventory. And so, like Governor Polis and 48 other governors, we need more. And we'll put it to good use, and we'll get out of this swiftly and safely. If you would, Dr. Box, give us kind of a update on the vaccinations and all of our numerical data that's driving all these decisions as they stand today.
Thanks. Happy to, Governor. Good afternoon, Hoosiers. More than 477,000 Hoosiers have received their first dose of vaccine as of today. That's an increase of 115,000 from last week. Of those, nearly 113,000 have received both doses and are fully vaccinated, and that number continues to climb. We continue to work to expand appointments and vaccine sites so that every Hoosier who is currently eligible can get a vaccine as soon as possible at a location that is convenient for them. In the past week, Meijer, Kroger, and Walmart have either begun offering vaccine or are preparing to do so at select stores throughout the state. You will see these locations listed on our map at ourshot.in.gov. As we add more and more vaccination sites, some of them will be using their own appointment registration system. So, for example, Meijer and Kroger will be using their own existing appointment systems. Walmart will be using the state system. What this means is that the 211 call center can only help you make appointments at sites using the state's sign-up system, such as hospitals, local health departments, etc. 211 will not be able to make appointments for you at Meijer or Kroger websites. We know this may cause some confusion, so we will continue to remind you. Please remember that these vaccines are available only to eligible Hoosiers and only by appointment. Do not walk into one of these pharmacies to get a vaccine without an appointment because doses are often spoken for in advance, and we want to save you time and frustration. Doses remain limited, so appointments do go quickly, but we are adding appointments as quickly as our supplies allow us to. As we work to expand eligibility, it is critical that our vaccine clinics adhere to the state guidance. We are hearing reports around the state of local health departments that are opening vaccine to people who are not yet eligible. This creates confusion across the state and puts those who are at greatest risk of being hospitalized or dying from this disease in a position where they might not be able to get the vaccine that they are eligible for. We are working to expand as quickly as possible, but we need everyone in this state to follow the same order of prioritization that we have laid out. This was done intentionally and with input from outside experts with the goals of preventing hospitalizations and saving lives. We continue to see improvement in our positivity rate, as the governor mentioned. Today, it stands at 9.1%, which is the first time it's been in under 10 in recent months. We also have seen a decline in the number of Hoosiers hospitalized with COVID symptoms. About 1,900 Hoosiers were hospitalized with symptoms of COVID as of yesterday. That is the lowest number that we have seen since early November. Our daily admissions have also fallen below 300, down from a peak of 526 on December the 7th. This is a welcome news not just for Hoosiers, but also for our healthcare systems and their dedicated staff who have been caring for COVID patients for nearly a year now. Our color-coded county maps are also showing significant improvement. This week, just 5 of our 92 counties are in red on the 2-score map, down from 34 last week. 2 weeks ago, 73 were in red. We also have 8 counties in yellow this week. This signals that we are starting to move in the right direction. Our advisory map, which indicates the level of restrictions that counties must follow, shows 58 counties in orange. That's a big improvement from the 17 that we saw in orange last week. However, it still leaves 34 counties in an advisory level of red, following our most stringent guidelines. As excited as we are to see these improvements, I caution Hoosiers that our work is far from over. In order to continue to move in the right direction, it is absolutely critical that Hoosiers adhere to the current guidance in their counties. That means wearing a mask, practicing social distancing, staying home if you're sick, and following the capacity guidelines outlined in the executive order. And it means following the CDC's quarantine guidance consistently in schools and at home. We have heard reports of schools abandoning quarantine protocols for their in-class exposures. The science clearly shows that quarantine helps prevent further spread of COVID-19. We continue to recommend, as the CDC does, that all individuals who are in close contact adhere to the CDC's quarantine recommendations so that we can continue to move Indiana in the right direction and keep our schools open and safe. I also want to clarify a question we continue to get regarding our restaurants. Restaurants can be and have been open to in-person dining, but seating must be placed 6 feet apart to maintain social distancing. Customers must be seated in bar areas and should not be allowed to congregate at the bar. So if you're able to do so safely, I encourage you to support your local restaurants. While we are encouraged by the improvements in our positivity rate and county metrics, we continue to see Hoosiers lose their lives to this disease. Today, we reported 40 new deaths. That brings our total losses due to this pandemic to more than 9,800 Hoosiers when you include the probable deaths that have been reported based on clinical diagnosis. That's an increase of about 200 since last week, which is also the lowest increase we've seen in the past month. There is no question that this pandemic has changed our lives forever. We continue to grieve for those we have lost, even as we work to ensure that the future looks much brighter. And on that note, Dr. Weaver will provide more detail about our vaccination efforts.
Thank you, Dr. Box. Since we rolled out our first vaccines in mid-December, the Indiana Department of Health has been working daily to increase access to vaccine and make the process of scheduling an appointment as easy as possible. To date, we have received 809,400 doses of vaccine. This accounts for both first and second doses. The additional doses we expect to receive from the federal government will allow us to open more appointments. This is still a small increase, however, and we will continue to follow our age-based approach to expanding eligibility to ensure that those who data show are most at risk for hospitalization and death receive first access to the vaccine. Over 700,000 Hoosiers have either already received or have scheduled an appointment to receive their first dose of vaccine. That total represents people age 70 and older, and healthcare workers, first responders, and residents of long-term care facilities. It includes 51% of Hoosiers age 80 and older, 57% of Hoosiers age 70 and older, and 60% of eligible healthcare workers and first responders. And more than 32,000 residents of long-term care facilities have received their vaccine, along with at least 13,000 staff in these facilities. When you factor in second dose appointments, more than 1 million vaccine appointments have been scheduled since December 18th. We are proud of how far we have come in a short amount of time, but as Dr. Box has said, we have a lot of work still ahead of us. We are working to make scheduling an appointment as easy as possible. We allowed family members to register on behalf of an elderly loved one. In addition to ourshot.in.gov, we engaged 211 from the beginning. To date, 211 has completed more than 173,000 calls. And approximately 1,000 workers at more than 300 libraries across the state have been trained and can assist with registration. We recognize that libraries are often the only way to access the internet because so many Hoosiers live in an area with limited internet access or cannot afford it. So far, our libraries have helped schedule about 1,300 appointments. This provides support not only to Hoosiers, but to our local health departments. In Delphi, for example, the local health department is small and is sending all scheduling inquiries to the library so that the health department can focus on administering vaccine. In Mooresville, the library set up an express station for COVID vaccine appointment scheduling and registration, and nearly 50 residents have used it so far. The library also placed a shortcut to the link on all of its library computer taskbars. Our area agencies on aging have registered 4,277 Hoosiers age 70 and older and have called 16,300 people to let them know of their eligibility. AARP began outreach on Friday and has registered 477 Hoosiers and called 848 people. We are also working on a pilot program with EMS to help vaccinate eligible homebound Hoosiers. This program is in its pilot phase, and we will have more details to share when it is fully activated. All of these efforts have greatly increased support for Hoosiers who need help scheduling an appointment, and we are incredibly grateful for this help. Our next step is to try to get people in sooner. We have heard the frustration from our seniors who are eligible now but cannot get an appointment until after March 1st. As we have added more appointments, we have identified approximately 4,500 individuals age 70 and older whose first dose appointment is scheduled after March 1st. Our partners at 211 will be reaching out to those people via email and phone calls to help them schedule an earlier appointment and cancel their later appointment. We wanted to do this outreach before we open eligibility up to the next age group. When we are able to do so, we will open to ages 65 through 69. We hope to be able to do that soon, hopefully in the next week. But for now, we want to ensure that we get Hoosiers age 70 and older appointments as quickly as possible. We are just as anxious to expand the eligibility criteria. Hoosiers might also receive a phone call from the hospital or local health department where they have scheduled an appointment to ensure that their registration is completed before they arrive. These callers will already have your information and will not be asking for Social Security number. Finally, I want to talk once more about hope. When we look at the hospitalization rates that Dr. Box mentioned, we are seeing declines in the numbers of elderly Hoosiers being admitted for COVID symptoms. While we have seen this decline before, it has bounced back up in the past. But as more of our seniors get vaccinated, our hope is that these numbers continue to decline. That truly would be a reason to celebrate. Thank you.
Dr. Dan, you want to do the switcheroo there and give us an update on our Indiana National Guard efforts in our long-term care facilities?
Thank you, Governor. So since November, soldiers in the Indiana National Guard have been actively supporting our COVID-19 response in long-term care facilities. The mission has involved over 1,500 soldiers and airmen and involved nearly every skilled nursing facility in the state. Due to the collective effort of our agencies and the arrival of vaccines, the rate of outbreaks and deaths within long-term care facilities are declining. The leadership within the Indiana Department of Health and the Indiana National Guard have now developed a strategy for the end of the long-term care mission that will allow service members to return to their civilian employment or to transition to other critical missions. The end of this support will tie directly to the date that facilities have their second vaccine clinic. Service members will leave the facility approximately 7 days after that second clinic date, and that will allow the soldiers to continue in the facility to provide support to the long-term care residents while they get their vaccine dose and their shot to returning to a more normal life. Due to the logistics of coming off duty, service members might leave a few days or a few days before or a few days after this time. The process will begin on January 31st and will continue weekly, with over 80% of Indiana National Guard men and women transitioning out of facilities by February 22nd, and all of them by March 15th. I want to personally extend my sincere appreciation to all the soldiers and their families who have supported this mission. They accepted the call and with honor have served by helping with data entry, by screening staff and visitors as they arrived, by disinfecting high-touch areas, helping with water and food delivery, visiting with residents in common areas, and providing support during the vaccine rollout. These soldiers put the lives of those who work and reside in our nursing homes ahead of their own as they left their jobs, their homes, and their families to help in the state's COVID-19 response. We have received countless notes of appreciation and heard numerous stories of how much this support has meant to those who work and live in nursing homes around the state. The work of these soldiers has boosted morale, helped free up staff to provide clinical care, and has no doubt, when combined with our other efforts, saved lives. To the General, to all his commanders, and to the brave men and women of the National Guard, we owe you a debt of gratitude and our sincere thanks and appreciation.
Thank you, Dr. Dan. Stand by. I'm sure you'll get some questions of interest. Next up, we've got Commissioner Payne. Fred, I mentioned the 4.3 number unemployment rate, but also you might elaborate on or give more of a kind of a contextual, the background of our labor participation rate as well, just how important that is in relationship to our unemployment rate. And then also, I think it was Nikki that asked last Wednesday about our new federal UI program, and if you could give us a status on the wait and the backlog there.
Okay. Well, thanks, Governor. So our unemployment rate continues to trend in a positive direction, as the Governor mentioned, since our high of 16.9% back in April. As it stands now, Indiana's unemployment rate is at 4.3%, which is the lowest among our Midwestern states. Our labor participation rate is 64%. That's very similar to where it was back in January of 2020. Indiana added about 83,000 people to our labor force over the month. Now, as it relates to some of our programs, I want to share just a little bit of information about some of the changes in several of those unemployment insurance programs. As you may recall, last year, under the CARES Act, we set up several temporary federal programs that paid out over $6.5 billion to eligible claimants. Some of those programs included the $600 weekly add-on for those receiving unemployment insurance benefits, a program that provided benefits to gig workers, independent contractors, and those who are otherwise not eligible for unemployment insurance called PUA, or Pandemic Unemployment Assistance, and a program designed to extend coverage for an additional 13 weeks beyond the normal 26 weeks of eligibility. That program was called the Pandemic Emergency Unemployment Assistance Compensation, or PEUC. The $600 add-on expired last summer, while the other programs expired at the end of last year. Also, at the end of last year, Congress enacted new legislation that modified or changed those programs. Here are some of those changes. There was a $300 weekly add-on to state and federal weekly unemployment insurance programs for 11 weeks through March 14th. We started paying this weekly add-on on January 8th to those collecting regular state unemployment insurance benefits. The PUA program, as I mentioned before, was modified. Specifically, it was extended for an additional 11 weeks through March 14th as well, and additional documentation requirements were added. This new or modified version of PUA became available to most PUA claimants on January 22nd. That's when we had the applications up for claimants. It will be available to the remainder of the PUA eligible applicants on January 28th. PEUC was extended an additional 11 weeks to a max of 24 weeks, and PEUC became available on January 22nd also. Since the release of the modified PUA and PEUC programs on January 22nd, we paid 77,000 individual claimants on those programs, totaling over $125 million. We'll continue to provide updated information on our website for these programs. Now I want to spend a little bit of time talking about a criminal element. I want to talk about fraudsters. As we've shared before, our unemployment insurance system across the nation, Indiana is included, we've become targets of fraudsters and scammers. These criminals are chameleons. They change their look frequently, and they take many forms. I want to give you some examples of what fraud looks like in our system. We have fraudsters purchasing someone's stolen information on the dark web and then filing for unemployment insurance benefits. We have fraudsters accessing a claimant's username, password, or other personal identifiable information from various scams, typically on social websites, and taking over unemployment insurance accounts. There are individuals filing an unemployment claim, typically on PUA, and providing false information. We also have had recently a fake web page set up using the name Indiana Department of Workforce Developments. They added an S to the end of developments. They got individuals to engage with them and to share their personal information so that they could scam them. This is an example of just one of the many attempts to steal claimants' information. We're combating this fraud by continuing to evolve our tools and technology to verify claimants' identity. Just to put this in a little context, when claimants are asked to verify their identity through one of our new identity tools, only 60% actually took the steps to do so. That's indicia that the 40% who never verified their identity can't because they may be fraudsters. Of the 60% that did attempt to verify their identity, 23% have been identified as fraudulent. We're seeing a large part of fraud in our PUA claims area. Specifically, 71% of current PUA claimants have fraud indicators that require additional investigation. This means about 3 out of every 4 PUA claims require some sort of additional processing, which could cause those claims to go well beyond 21 days of processing. Regardless of the tools we put in place, our best defense against fraud remains businesses and individuals. If you see something suspicious, please let us know. Our commitment is to ensure that we pay every eligible Hoosier the benefits that they're entitled to, not the fraudsters. Finally, I'd like to remind us that there are resources available for training and education to those Hoosiers who are interested in career and training opportunities. You can find resources at our website. You can go to nextleveljobs.org, or yournextstepin.org. Thank you.
Thank you, Commissioner. That's just another reminder that, this pandemic has brought out the best in many people, and it's also encouraged the worst in some, but puts the pressure on others to go the extra distance. And so I just appreciate everyone that's over at the Department of Workforce Development, just as much as all the frontline healthcare workers that are doing extra duty and double, triple shifts and going without sleep now for almost a year straight. A couple things that jumped out at me real quickly. Dr. Weaver mentioned very quickly. She talked about 65 to 69. I know that's probably perked a lot of ears and got a lot of eyes to widen. And she used the word soon. So just that, soon. Again, we'll let the data drive our decisions, but I think it'd be accurate to say days, not weeks, is what we're looking at. And we are prepared. We talked about how we've got the logistics and the infrastructure, the network built out so that we can accommodate the demand. The only, we're working on getting to those most at risk, and we will be able to keep up with the supply. But we're dealing with the most at risk. And what you said, when you mentioned the deaths
Lindsay's story from
in
last
excess of
night on
9,800,
the Black community was
and
trending, so I think it might get some better
that's
numbers tomorrow than
about
I
10,000
saw,
is
from today than what I
it's
saw
like,
when I looked today.
Mooresville
So
or
that's a reminder
Kendallville or
to
Greencastle,
keep
when you
that
start to
step
think
around
about the
online.
different sizes of communities around
And,
Columbia City, an
that's
entire,
about it. We did notice that,
and so we've got to make sure we're focused on the most at risk of the folks that we're losing or that are finding themselves in the hospital, and then maybe worse than that. So with that, Rachel, we'll turn to the Q&A
So we went
portion.
ahead and put up
Whitney
banners.
Downard,
We have a banner,
CNHI.
and I went ahead and just
Good
grabbed
afternoon,
the story
Whitney.
that was trending and put it back online. And
Indeed,
it's
I do
been
have a
trending
question for Dr.
it's
Fox
back on
first
our
off,
homepage, and it's been
and
trending
then
all
I'll
day.
have another question. But my first
And
question
it's
is,
6 months
as the
old,
vaccine is getting
and
rolled
it's
out,
doing
are we
quite well, and
revisiting
it's
our
still relevant.
guidelines
It's
for
just
nursing
her
home
family and friends
visitation?
talking
What are
about
the
her
factors
life
that we're
on the 1-year
considering
anniversary
as
of
the
her death.
vaccine starts getting
So-
distributed to those residents?
So it's all
So
relevant
I'm
to
sure Dan
today.
Prasiniak, Dr. Dan will have something to say about this too, but most certainly our goal and our hope would be that visitation in long-term care facilities change. And I know that Dr. Prasiniak and his team has an essential family caregiver program that is working very well. So Dan, do you want to comment on that?
Yeah, that's a great question. Right now, we're really waiting on communication from CMS to change the requirements on visitation. They currently have in place and have let us know that they've not changed it yet based on vaccines. I think we're hopeful, along with others, that the data will come out and show that being fully vaccinated not only decreases your risk of getting COVID, but decreases the risk of transmitting it. I think once we have that, we'll be ready to make those changes and guidelines the moment we hear from CMS. So like others, we're waiting and hopeful because we'd really like to open it back up, and particularly would like to get those residents who have been vaccinated back in contact closely with their families.
You had another question, Whitney?
Yes, and I just wanted to kind of emphasize our deaths and our hospitalizations have gone down, so has our positivity rate. Those were we were trying to get those down so that way we could move beyond vaccinating just elderly. Why not move to vaccinating teachers and other essential workers now when our hospitalization rates and our case numbers and death numbers are going down?
Well,
And Lindsay's coming to the table, but
yeah, we still have more ways to go in terms of our most at-risk populations, including 60 and above. And so when you look at the 370,000 populations and the 450,000 populations, those increments, Lindsay, maybe you could talk about that before we get to this continued orderly, methodical, keep it simple to get folks not just appointments but the shots in the arms.
Right. So as a reminder, by vaccinating or 60 and older, that's 93% of our COVID deaths and 64% of our hospitalizations. So we still have a whole decade of people in order
will
to
probably-
really get to covering all those
Yeah,
people
it'll
that are
probably have to
most
be,
at risk for hospitalization and
Josh.
death. And we have 350,000
But no,
people
Josh
who are
isn't-
in the 65 to 70 age
Josh-
and another 400,000
Josh isn't
plus in the 60 to
available
65. So we
tomorrow,
have
I don't
quite a few
think.
more people that we need to work through. And as a
So-
reminder, we're getting now around 90,000 first doses
not
a
at
week, so
11
you can see,
because
well,
he has
that
one
will
more
take some time.
Tire appointment.
Yeah, and I would just say, Lindsay, maybe you could comment
So
on this
it might
again.
have
You
to
touched on,
be
this is an
either
important chart because when we were talking about
after-
saturation
I don't know
rates
what
and we were
time,
talking about,
I don't know
reports
what
of
time
how
that-
many people would get
Surely
vaccinated,
the
this is
mayor
showing,
thing
let's
will
not
be
get
2
ahead of
hours,
ourselves
will it?
because Hoosiers are stepping up and doing the right thing.
Yes, thank you, Governor. It is very exciting. I mean, we were really hopeful
Yeah,
that
so
we
I'd
would
say
get
we could
50,000
do-
or
we could
50% of
send
people, and of
Zeke
course, we're
after
hoping that we get
mayor's
more. So to see
speaking
that we have
at the
60%,
chamber,
up to
or
60% of
Taylor
people
is
in these
talking
different
to the Terre
populations
Haute
getting
Police
vaccinated
tomorrow
is
about the
really exciting. And there's
hiring
more work to do. I mean, we think
process,
that
so
by
she might be in the
the
area
outreach
too.
that we're doing, calling people, sending
see
them
what her
cards
schedule
in the
looks like,
mail,
what time
all
her
of that,
interviews
it just
are.
all
Taylor's
those little
gonna
bits add
send
up,
her,
and we
if
can
not
see
on
that
the
number tick up
17th.
every single week.
Yeah,
Hit one and then
mobile
the other
units
on his
and
way back
the
through.
aging, the AARP and the libraries, as you really elaborated on. These are all things that are helping, and the more people that get it, you hear anecdotally that people see that it's safe, and there are very few adverse reactions, and just those testimonials of, yeah, I got vaccinated, and it was easy to do, and I didn't have any, circumstances that arised out of it. So this is encouraging.
Brock Turner, WFIU.
Afternoon, Brock.
Good afternoon, Governor, Dr. Box, and everyone. I have two questions here. The first is probably for Dr. Weaver. When we're talking about vaccine administrations, you said about 477,000 have been administered, and then about the states received thus far about 809,000 doses. That makes for about 59% that have been administered. What percent of those have expired? What percent of those just haven't been administered to this point?
So again, to my knowledge, so none expired. We do everything we possibly can to get every single dose into an arm. I can't say that absolutely no doses have been wasted, but none have been reported to me. So they do work exponentially at all of the different sites to make sure that all doses go in arms. The difference there really is that you don't put every single dose that you receive on the day that you receive it. And because we have set up the scheduling system and we've made it, so safe and efficient for people to socially distance and be able to wait there 15 or 30 minutes, it's spread out evenly over all the days. So there will never be one day where we say every single dose that we've received has gone into an arm. If that were to happen, that means we've run out of vaccine, and we're doing everything we can to make sure that doesn't happen.
Yeah, the whole scheduling process.
And then my follow-up, it's probably for one of the doctors as well. Earlier this week, a jail in Bartholomew County was placed on lockdown after nearly half the inmates tested positive. Can you just describe, or one of you describe, where jails or prisons rank in the vaccine distribution? Is that something that you're going to specifically, are those facilities you're going to specifically target? And then is there a 2-week quarantine for prisoners leaving those facilities currently?
So with regards to vaccinating staff in our Department of Corrections, the frontline staff, we have already done first doses for all of our Department of Corrections across the state. State Department of Health worked with Dr. Kristen Doss to accomplish that, and we'll actually be starting, I think, back this next week for the second doses for those individuals. We also have been vaccinating individuals that reside there that have met also the same criteria. They're in their 80s or they're in their 70s. With regards to jails, the sheriffs and deputies there that are frontline workers were also vaccinated with law enforcement if they were interested in being vaccinated. We do notify individuals at counties if we know someone has COVID and they're coming out, the local health departments, so that they can work to set up a place where those individuals can quarantine.
Eric Berman, WIBC.
Afternoon, Eric.
Good afternoon, Governor. I will continue the trend. I have two questions. My first one is for Dr. Box. You scolded schools and some local health departments in your opening remarks for not following, in some cases, quarantine rules and not following, in some cases, the vaccine eligibility. What, if anything, is the state doing about that? Are there repercussions? Is there enforcement? Is it just a scolding directly to them? What happens from here?
I try to call it more of an education. I mean, we work very closely with them. We try to make exactly very clear to our vaccination sites what individuals are being prioritized and what individuals are now eligible to receive the vaccine. And out of equity, we want to make sure that we follow that closely across the state at all our vaccination sites. So it's usually to this point just been a matter of reaching out and directly speaking with them and explaining to them that we understand they're not following the prioritization schedule and that is what is required in order to continue to be a good partner with the State Department of Health in receiving vaccines. With regards to schools, we've had multiple touch points and discussions about this. I know especially some of the schools over on the Ohio border of our state. Ohio took away any quarantine just for exposure within the classroom. If you were masked and socially distanced and you were within the classroom for that exposure, that is not where Indiana has gone based on having this mutation and the very high spread that we have had. Now, that is improving, and we're really glad to see that, but we still do have high community spread in many areas across our state. So we really are continuing to support the CDC's guidelines and make that very clear as we educate local health officers, superintendents, administrators across the state that is what the Department of Health supports.
Eric, your follow-up?
Yeah, back on the question of vaccine, Governor, you mentioned last week that we don't have enough doses to do mass vaccination sites. I'm wondering, I think Dr. Weaver said the additional 13,000 is still a small increase. What's the point at which that would be practical, or the point at which it would be practical to expand beyond 65-year-olds?
Well, I'll let the doctors give the clinical response, but I'll tell you that 13,000 over a course of 92 counties gets spread thin, as you might imagine. And we have a very orderly process set up. And a lot of credit should go to Dr. Sullivan, Jen Sullivan, and Dr. Box and Dr. Weaver having these single ports of entry, be it online to schedule your appointment and or calling 211. This is working, and I realize when we first opened this up and we had a couple 100,000 people calling the line that the wait was longer. Now this is under control, and so when you're adding 16% to our overall number, that gets spread out across the whole state to where we can still be close to folks. Now, if we needed it, and maybe there's some other states. I was on a call last night with a lot of governors, and North Dakota chimed in and said, we've got people that would travel 2.5 hours to, if you set up a single site, a FEMA assisted, and we appreciate their offer. We want them to know that we have this already in place in every county and have the ability to get it out faster into the arms, whether it's increase of 16% or 32%. And by the way, we're hearing more positive news coming out from other companies that maybe they'll come online too. So as we all get smarter as the days go by and the pharmaceutical companies are able to follow their own best practices and lessons learned, and that's what's led to this increase, I'm happy about that. But again, we'll continue to clamor for more up until every single Hoosier gets the vaccination that they're asking for. Dr. Weaver, you want to clean that up, or Dr. Box, you want to?
I think you said it very well, Governor. I mean, part of this is we need more than just an additional 13,000 doses to really consider that mass vaccination sites just in 2 or 3 places in our state make sense. Right now, We're dealing with an elderly population that
Yep.
doesn't travel as well, that, may have to use the bathroom, that, it's just not a comfortable thing for them to get in the car and go 2 hours away. So the more out of equity we can have many sites across the state that are staffed with as much vaccine as we can give them, that is a much easier thing for our Hoosiers to get there. And that's really critical at this point in time. And it's also important, like our FQHCs and our community health clinics, that they are located oftentimes in our lower socioeconomic and our populations, our minority populations. So we want that to be on a bus route where people can actually get there. So Lindsay, do you want to add some more to that?
I agree with both of you that making it convenient for people is why we've been so successful in people getting vaccinated, that people want to go to a place that they trust and they know that is in their own county, that is in their own town. And so I will also just add that we do have mass vaccination sites going on. I don't know what number anybody's looking for, but right here in Indianapolis, Methodist is putting through 1,100 people a day. I mean, that's all they're doing, patient after patient after patient. And that's happening all over the state at local health departments, at other hospitals, have rented out or are working out of very large buildings in order to do so. So just because people aren't lining up in the street or because they're not lined up down a road to get into a parking lot, that doesn't mean that we don't have significant number of people moving through a day. So just today we had 28,000 Hoosiers scheduled to get their vaccine.
Max Lewis, WSBT.
Afternoon, Max.
Good afternoon, Governor. How are you?
Pretty good, all things considered.
Good to hear. Good to hear.
Yep, thank you.
I have a couple questions. So my first one is about this sort of expanding pool of places that are going to be giving out vaccines, these Kroger and Walmart and these stores. I sort of wanted to know what communication is going on from the state to local health departments, because a couple of our local health departments said they sort of found out about this just, at the same time the general public did. And so is there any, does the local health department have an idea how many doses are going to this store and sort of what's, when these stores will start to vaccinate, and what's sort of the communication with that?
I think that's a really good question. We message multiple times during the week through emails, through letters, through webinars that we do. We used to do them twice a week. We do them once a week now with local health departments to let them know what we are doing, where we are, and what may affect them or what they may see within their own county. Whether that's an opening of a federally qualified health clinic for vaccination or a community health clinic, whether we're going to be able to give them more doses or the hospital will get more doses. We have been doing our incredible best to make sure that we message that on a very regular basis. We also get multiple outreaches and questions from our local health departments across the state on a daily basis, which we are continuously answering. So it makes me sad to hear that someone says that they found out in a different way about that. We do sometimes talk about it as this is coming, this is one of our next steps, this is one of the next things we'll do, and they may not actually hear the announcement that, hey, it's here or it started this day directly from us on that same day. Lindsay, any other things you want to add to that?
Thanks, Dr. Box. I would just add that we're constantly in preparation mode, that if any given week they come and tell us you guys are going to get another 100,000 doses, that we have the places across the state that are ready and willing to get started. So by getting some of these pharmacies who are in important locations where we do believe it will make a difference to have a pharmacy vaccinating there, and we're starting them out with small doses. So that means that they have everything in place, they have the storage capacity, they are connected, they are ready to schedule all of those things, so that when we do get more vaccines and we have reached the capacity of the local health department's location or their ability to vaccinate, then we can very quickly pivot and make sure that we're getting all the vaccine that we're getting out.
Yeah, but our methodical approach is not changing. We're updating them on inventory levels, but you're starting to see, not to pat ourselves on the back, but you're starting to see other states now go to this age-based approach, because it is efficient and it's dealing with the most at-risk population right now. And as you work your way down, that's not changing.
Brandon.
Yes.
Oh, sorry.
Yeah,
I just
go
had
ahead, Max.
one additional question. And then I also want to know, now that we've sort of transitioned from the Trump administration to the Biden administration, has any of the communication from the federal level changed at all, or how are things different? I saw some statements that they're going to give you more of a 3-week forecast of where vaccinations or where doses will be, rather than, sort of on a weekly basis. So what has changed, if anything, about how they're sort of approaching this situation?
I'll let you two speak for yourselves, but it's been seamless from my perspective. I mean, the communication, the access, the connectivity is the same, and it's appreciated before and in the past administration and in the current administration.
I would agree. I think that it was messaged to you that we would know what our allocation was going to be for the next 3 weeks. So we're kind of waiting to get that same messaging, but we will get that messaging when we talk to OWS and we talk to the CDC about our vaccine. So we have seen this as just a seamless transition, and that's really the way it should be.
Yeah.
Brandon Smith, Indiana Public Broadcasting.
Afternoon, Brandon.
Afternoon, Governor. Afternoon, Dr. Box. I have 2 questions, as you might expect.
Is this the Bourbon rule, the 2 questions?
We're trying to be respectful of our fellow reporters.
I got you.
The first is for Fred Payne. Director Payne, we've heard a lot from lots of people that this past weekend they had multiple problems accessing unemployment benefits. Some couldn't get their ID verified through ID.me. There were problems for people on PEUC not getting the right claims to file for benefits. Are those problems fixed now? And if not, where do we stand?
Sure, good question. And this kind of goes back to some of our fraud. ID.me is one of our vendors that's verifying the identification for claimants, and ID.me has let us know that they too have been bombarded with fraudulent attacks as well. So there's a little bit of delay there with them. In terms of some of the other delays, some delays in our system could have easily been caused by generating the 1099 forms, as you know, or as others may know or may not be aware, that unemployment insurance is taxed. So those types of things contributed to some of the slowness in the system. The one thing that I would like to reconfirm is that our IT system is working at a maximum capacity. And if we had not made upgrades to the IT system over the last few years, I could only imagine how we would be now. So we're relying on that, but those are some of the reasons. Unless I know specifically about which particular matter you're talking about, I'm going to have to give that general answer.
You had another question, Brandon?
Yeah, so our COVID numbers were bad. We went to these strict color-coded county-based gathering limits. The numbers have started to get better. We relaxed the restrictions. Seems we've done this before, and the numbers go back in the other direction because people think, oh, things are getting better. We can relax. Aren't we setting ourselves up for the same fall all over again?
Well, you have multiple assumptions baked into your question that you're assuming that this is all driven by capacity numbers. It's the point of these best practices and public health measures that we're recommending is that we can control the things that we can control, and we can manage our way through this. We know what works, but it is a constant balance of our lives and our livelihoods. And to think that when you look at Ohio, Indiana, Kentucky, Illinois, where numbers are different, but as this virus ebbs and flows across the country and goes from the Midwest to the coast and back, you're right, Brandon. We've been here before, and we have to act accordingly when we're in the position that we're in. We took a very cautiously optimistic approach over the last week. We wanted to make sure things were trending in the right direction for more than just that past. I talked about January 11th, but we're now at 9.1. That doesn't mean we're out of the woods. When you looked at the map, when you looked at the orange and the red counties, and that will hopefully change for the better by the time we're back here next Wednesday. I suspect it will. Or I should say, if not, then we'll have to make recommendations appropriate to those numbers as well. But we'll continue to look on this as hourly, daily, weekly basis. Lindsay, you look like you had something that you wanted to add, no? Or
I think the important thing is the restrictions are still tied
That's
to
true.
the color of the county that
yeah.
they're in, right? And that
Yeah.
you have to be in that improved color for at least 2 weeks before we change. So it's not like we opened it up to everything, no matter what the color and the community spread was within your county.
Meredith with WLFI.
Afternoon, Meredith.
Good afternoon, Governor. So my question is also in regards to the vaccination sites that are going to be opening up at Kroger, Walmart, and Meijer. One question is, how come one of those establishments is choosing to work with the state, but the other one is not? And then along with that, do you have a date on when this will open up? And will there be any different kind of pricing for this, or will it be similar to how it works at the state sites?
Dr. Weaver.
The vaccines, there will be no charge to the patient at any location. So I want to make sure that is very clear. However, they will collect insurance information at all sites, but if you do not have insurance, then you will still get the vaccine again at no charge. So that doesn't make a difference between any of the different locations that you will go to. As far as the pharmacies and the Meijers and the Krogers, they already have, some of them already have systems that are set up to do this on a national level, and they will be sticking to our eligibility criteria here in Indiana, of course. But then, for example, Walmart already uses the Zotex system, which is the system that we use for scheduling across the state, and so they're going with that. We want to make it as easy as possible on everyone, and that's why we direct everybody to ourshot.in.gov so they can find the location that is nearest to them. And when you click on that location, that will direct you to that scheduling place, no matter where it's at or what the location is. So if you just use that, it's very similar to how we set up testing. If you go to our testing website, it's the same thing. You find the place nearest you and you click on that place, and then it'll direct you how to schedule for testing at that site.
Dirk with Wayne TV.
Afternoon, Dirk.
Good afternoon, Governor. The question is only one, but it's kind of long. So the restrictions you've said before you're open to legislative input on this, but the devil's in the details about what you would support. Have you had a chance to look at the amendments proposed in HR 1519 that suggest the elimination of occupancy restrictions altogether? And is the change you announced at the beginning any result of the testimony that was given before that committee that suggested large reception halls sometimes had fewer people in them than smaller restaurants or bars?
I can respond to what you just mentioned, and that would be counter to the approach that we've taken over the last 10 months. But no, I've not dug into all the different amendments. I know this is a long session and met with leaders, the President Pro Tem and the Speaker of the House this morning. We'll stay in very close contact. We all have the same goal, and that's to get out of this. Again, sound like a skipping record, but safely and swiftly as possible. What I don't want to do is sacrifice any of the approaches that we've taken that have gotten us to this day. While we are seeing Rome burning, literally and figuratively in other places, here we're trending in the right direction. And some of that has to do, as I said, and thanks to businesses and people. And I almost grieve at the deniers and defiers, because that just means everyone else has to do more or stand by and watch. And when I go out and pick up my lunch or my dinner and I see people practicing the things that work, that are getting us to a 4.3% unemployment rate, having the revenue come back into our coffers that then enable us to target that to those who are in need, whether it's they're hungry or homeless or struggling with some mental health issues. We need our economy. We need our kids in school, and we can do it safely. It costs, and so this is the balance that I was referring to Brandon. We have a lot of factors that we have to consider, and we have to consider them on a day in, day out basis. So that's one response. Secondly, Dirk, I would submit to you that whatever we do, again, we share the same goal, has to be constitutional. And that's where my fidelity is and lies and loyalty lies. And so I want to make sure that we're thinking about the collective good. Absolutely. I think they leaders on both sides of the aisle and members share that concern. There are a lot of different opinions across the world, not just in the state of Indiana. I'm very respectful of that and very open to their input as long as it helps us as long as it helps us achieve our end goal, and that's to get out of this as swiftly and safely as we are doing right now.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.
So we'd have to use Savannah's for now, but if you want to look it over, I've not published it yet. Yep, I can do that. Okay, wonderful, thank you. And if you have any tips, just let me know. Okay. And if you don't want to use it, that's okay. Just let me know that too.
Okay. I'm gonna run to the restroom and then I'll give it a look.
But I got hold of Debbie.